Sharp pain on one side of your belly during pregnancy can feel scary, especially when it hits you as you move or roll over in the middle of the night. But most of the time, it's simply a normal part of your body stretching and adjusting. That said, the location and the timing do matter, so let's break that down. On this channel, we talk about pregnancy, women's health, babies, and being a mama. So if you're new here, make sure you subscribe. And let me know down in the comments section if you're pregnant, and if you are, how far along you are. But now, let's jump into why you might be feeling this sharp pain. Sharp pain on one side during pregnancy can be really unsettling. It's localized. It makes you pause and think, wait, is something wrong down there? The reason it feels so alarming is because one-sided pain feels specific. It doesn't feel like general soreness. It feels targeted. But here's the truth. One-sided sharp pain is very common during pregnancy. A lot of the time, it's simply part of the normal stretching and shifting your body is doing. What really matters is the context, meaning what other symptoms are present, what the pain actually feels like, and how intense it is. The goal of this video is to help you recognize patterns, so you know when you can rest and monitor it, and when it makes sense to check in with your medical provider. Here's how many women describe it. A sudden, sharp jab or stabbing sensation, usually on either the right or left side of the belly. It often shows up when you change positions, getting out of bed, standing up from the couch, rolling over, or even just sneezing or coughing. Many times, it comes and goes. It might disappear completely and then return later. And because it's sharp and sudden, it can feel frightening, even if it only lasts a few seconds. This is your uterus, about the size of a uterus before pregnancy. It doesn't just float inside your pelvis, it's supported by ligaments. One of those is called the round ligament, and you have one on each side. As your uterus grows, those ligaments stretch, and because the growth happens gradually, they're slowly pulled tighter to help support that expanding uterus. When a ligament stretches slowly, it can feel like a dull ache. But when it stretches quickly, it can feel sharp, like a sudden tug. That's why movement often triggers it. Standing up quickly, rolling over, twisting, coughing, all of that can create a quick pull on those round ligaments. Your uterus shifts slightly, and that supportive tissue stretches suddenly for a brief moment. This also explains why the pain is often one-sided. The pull isn't always even. Your uterus can tilt. Your posture can shift, your baby's position can place more tension on one side than the other. So here's the key takeaway. A fast stretch can feel sharp, and movement increases the chance of that fast stretch happening. But keep this in mind. Round ligament pain is very common, but it's not the only reason you might feel pain on one side of your belly. There are several other causes that can make one side hurt more than the other. Sometimes it's simply muscle strain, especially as your posture shifts, your belly grows, and your hips and lower back start adjusting. That can absolutely show up as sharp pain with movement. Sometimes it's gas or constipation. As your uterus expands, your intestines get more crowded. Gas can become trapped, and that discomfort can feel sharp. The good news is it often shifts or improves after you pass gas or have a bowel movement. Sometimes it's ovarian stretching, particularly early in pregnancy when tissues are still adjusting to all the changes happening. And sometimes it's just your baby's position. Your baby might be leaning or pressing more on one side, making that area feel more tender or sensitive. The common thread with all of these causes is pattern. They're usually positional. They tend to come and go, and they often change with rest, movement, or simply with time. This is where pattern matters more than location. Even pain that comes and goes, especially when triggered by movement, behaves very differently from pain that's constant and unrelenting. Remember, you're not trying to diagnose yourself. You're observing the pattern so that if you decide to check in with your medical provider, you can clearly describe what you're feeling and how it's behaving over time. There are certain patterns that shift this into the category of worth getting checked out. For example, if the pain becomes persistent and doesn't ease up, if it progressively worsens instead of improving, if it occurs even when you're resting, if it's associated with fever, nausea, vomiting, chills, or dizziness, if you just feel generally unwell along with the pain. Also, keep in mind that right-sided lower abdominal pain with fever is a pattern that should be evaluated right away. You can also experience upper abdominal pain, and that's important too, especially if it's accompanied by a headache, vision changes, or just an overall sense that something feels off. Upper right abdominal pain can sometimes be related to the gallbladder. Gallbladder hormones can slow down gallbladder emptying, which may lead to irritation or even the formation of gallstones. That type of pain is usually higher up, right under the ribs. It's often worse after eating, especially if you've had a fatty meal, and it typically doesn't change much with movement. That creates a very different pattern from the stretching pains we talked about earlier. Now, none of these patterns automatically point to a specific diagnosis. They simply fall outside the usual behavior of normal pregnancy aches, and that's when it's worth getting checked out by your medical provider. One important thing to remember is that medical providers don't make decisions based on a single symptom. They look at the full picture: how far along you are, how the pain started, what makes it better or worse, and what other symptoms are happening alongside the abdominal pain. And on a side note, I truly hope you never feel like a needy patient for reaching out to your provider. Checking in can help you understand what your body is doing, and very often it brings a lot of reassurance. One-sided sharp pain during pregnancy is often part of your body stretching and making space, along with things like muscle strain, constipation, or baby movements. It's not always comfortable, but it's often completely normal. When it behaves like short-lived, movement-related pain, rest and gentle movement usually help. But when the pattern shifts, when the pain becomes more persistent, more intense, unrelated to movement, or is paired with feeling unwell, that's when it's time to check in with your medical provider. And by the way, if you're new to my channel and you enjoy learning about your pregnancy and your changing body, I have a full pregnancy series where I walk you through pregnancy week by week. We cover baby development, common pregnancy symptoms, how to manage them, what to expect at each OB appointment, and so much more. Thank you so much for watching.